All right, so I'm not sure if I did this video right, but we're gonna wing it and go for it. I'm gonna start out with the production of ROS and how it's altered in aged neutrophils. It still remains a controversial issue. A guy by the name of Agua recently detected an increase in spontaneous ROS production by aged human neutrophils, but no difference in the FMLP or LPS induced ROS production. Studies by Fulop indicate that the kinetics of ROS production may be altered in aging as superoxide anion levels from aged humans neutrophils are lower than those of young neutrophils as at early time points such as 2 minutes and 24 hours, but higher at later time points like 48 hours. In a small study conducted in Spain involving young and middle-aged individuals as well as the elderly, superoxide anion concentrations in neutrophils were found to increase with age. A report published by Nishio suggests that greater numbers in neutrophils are required for wound repair in older mice rather than young, perhaps as a result of reduced neutrophil function. Although upregulation of CXCR4 expression has been established in human neutrophils that have been aged in culture, there is no published work that describes the expression of CXCR4 on neutrophils of the aged individuals. Clearly, as atherosclerosis is considered primarily to be a disease associated with aging, further investigations aimed at unraveling how age-dependent changes in neutrophil function contribute to the pathogenesis of atherosclerosis demand our prompt attention. Atherosclerosis is usually diagnosed early. It develops gradually. It can start when you're a child, but you may not experience anything until you're older. Mild atherosclerosis usually doesn't have any symptoms. You usually won't have atherosclerosis symptoms until an artery is narrowed or clogged that it can't supply adequate blood flow to your organs and tissues. Sometimes a blood clot blocks blood flow or even breaks apart and can trigger a heart attack or a stroke. If you have atherosclerosis in your heart arteries, you may have symptoms such as angina or chest pain. If you have atherosclerosis in the arteries leading to your brain, you may have signs and symptoms such as sudden numbness or weakness in your arms or legs, difficulty speaking or slurred speech, temporary loss of vision in one eye, or drooping muscles around your face. These signs signal a transient ischemic attack or a TIA, which if left untreated may progress to a stroke. If you have atherosclerosis in the arteries of your arms and legs, you may have symptoms of peripheral artery disease, such as leg pain when walking or claudication. If you have atherosclerosis in arteries leading to your kidneys, you may develop high blood pressure or kidney failure.